Hi, my name is Dr. Tim Lynn, and what I'm going to talk to you about here today is what makes us different. What makes our practice different than any other practice that you've been to. And there's one primary reason, and that main reason is we treat people neurologically and also metabolically. Those two go hand in hand together. So we're going to talk about that here today. So what do I mean metabolically? We're going to talk about that first. Well, in order to find out what's going on with somebody, you need to look at everything. You need to do a complete, thorough evaluation and investigation to figure out what's going on with them. So looking at them metabolically, we look at a lot of different lab panels. Lab panels are very, very important since everybody's uniquely different. You can have 10 people in the room and all have identical symptoms, but all these symptoms are coming from other various organs, various dysfunctions going on in the body. So it's very important that you need to look at this stuff so you can figure out what's going on with every individual. That's another thing in our office. We treat the person, not the diagnosis or the condition, because like I said, everybody is so specifically individualized. You need to find out what exactly going along with them. So we do lab tests on people. And lab tests include a thyroid panel, a complete metabolic panel, a lipid panel, a CBC with auto differential. And basically what that is, that's your basic lab panel. And most of you have had lab work done already. Come back, things are normal, they look good, but you still have the condition, you still have the problem. I evaluate it a little bit differently. I look at the ranges, I scrutinize the information much greater, and look at everything as a whole and bring all that information together. That information from the complete metabolic panel and the thyroid panel and the lipid panel and the CBC, the complete blood chemistry, that can give you a lot of information what's going on with somebody, with your sugar level, with your glucose level, with your gut function. Is there inflammation in your body? But you can gather a lot of information from those tests right there. Other tests that we do is we look at sensitivity testing. A lot of people with chronic conditions, whether they're having chronic fatigue, chronic indigestion, constipation, bloating after eating, a lot of this is coming from food sensitivity, so we test for that. There are some very common foods that can cause sensitivities, and that can also lead to some chronic problems that people have. So that is another thing we test for. Something else we look at is we do an adrenal stress index, and basically what that is checking the level of your adrenal glands. And our adrenal glands are stress organs, and they get stressed out in a lot of different conditions. If someone is having thyroid conditions, they have to have their adrenals checked out because the thyroid and the adrenals go hand in hand. Another thing with people that is suffering from insomnia, or in the afternoon, they just need a nap in the afternoon. More likely than not, that's your adrenals malfunctioning. So we run these tests, and basically what it does, it measures your cortisol levels throughout the day. Our cortisol levels go up and down throughout the day and night. And if there's a problem with that, we can see not only that there is a problem, but exactly what the mechanism is involved. And what's important with everybody is finding out the mechanism involved. Like I said earlier, it really doesn't matter if 10 people have insomnia. They can have 10 different mechanisms involved, or 10 people with chronic pain, or whatever their symptom may be. You need to look at the mechanism and resolve the mechanism involved. Another thing we need to look at is autoimmune disorders. And basically what autoimmune disorders mean is your body's attacking your body. It can attack your thyroid gland, and that's called Hashimoto's thyroiditis. It can attack your nervous system, and it's called multiple sclerosis. It can attack your connective tissue. It's called lupus. It can attack your brain. It can attack everywhere. If it attacks your gut, there's a lot of different things going on called leaky gut syndrome. Regardless of the fact, what that means is your immune system is attacking your body. So it's not a gut issue, a thyroid issue, or a connective tissue, or a nervous system issue. It's more of an immune system issue, and you need to look at the immune system. So we test for that to see if the immune system is involved. There are other immune system panels we can get into on specifically if we have trouble looking at them. We can look at their Th1 and Th2, which are part of the immune system. Another thing we look at is hormone panels. We need to evaluate the hormones on some people to see what their balance is. And by doing that, we can gather a lot of information. And another thing that we also test for is inflammation. Majority of people that I see not quite all, but most, they have massive inflammation in your body. And chronic inflammation, there was a study published 2009 in the American Journal, Journal of American Medical Association, and basically what it says is inflammation is killing people. So if someone has massive inflammation in their body, we need to find out, A, what's the cause of it, get rid of the cause, and then restore normal balance, get rid of the inflammation. So the big thing that makes us different is we got to treat everybody individually and treat the person, not the diagnosis. But by doing that, we need to look and find out to see what is causing the problem. And that is one of the main reasons that makes us different in our office.